Why do children get febrile seizures with the flu? Imagine a young child suddenly experiencing convulsions during a fever. This common event, called a febrile seizure, often happens when children have the flu. The flu virus, especially influenza A, tends to cause high fevers quickly, which is the main trigger for these seizures. Febrile seizures usually occur in children between 6 months and 3 years old, and they happen because of the body's response to rapid temperature rises, not because of the infection itself directly damaging the brain. When a child gets the flu, their immune system reacts by releasing chemicals called inflammatory mediators. These include cytokines like interleukin-6, which can increase the electrical activity in the brain, making seizures more likely during a fever. Studies have shown that children with influenza who experience febrile seizures often have higher levels of inflammatory markers, indicating that inflammation plays a key role in making the brain more excitable during illness. Influenza A is particularly known for causing these high fevers and inflammatory responses. The fever can spike quickly, sometimes reaching above 101 degrees Fahrenheit or 38.3 degrees Celsius, which is enough to trigger a seizure in susceptible children. Some children may have repeated seizures during the same illness because the fever persists or rises again, especially if the infection is severe. Genetics also influence the risk. Children with a family history of febrile seizures or epilepsy are more likely to experience seizures during a fever. However, it is important to know that febrile seizures are generally harmless and do not cause long-term brain damage or increase the chance of developing epilepsy later in life. In summary, children often get febrile seizures with the flu because the virus causes high fever and inflammation, which increase brain excitability. The rapid rise in temperature and the body's inflammatory response make the brain more prone to seizures in young children. Managing fever carefully during flu illness and monitoring for neurological symptoms can help keep children safe. Always consult a healthcare professional if a child experiences a seizure to ensure proper care and reassurance.